Welcome to www.coronavirustownhallmeeting.com. I'm Karen Turk, your national moderator with the Esther 414 Foundation. We're here today to spread the truth and not the virus, and give you resources within your local community that can serve you at a local level while dealing with this national crisis. We're really proud to be here, and we've partnered with a lot of local community leaders to give you information that's specific to your local area to help you in this time of need. We invite you to ask questions, interact, log in, and get the help and support. We'll also be available offline after the town hall to answer additional questions and provide you with additional resources. On hand today, we have Dr. Lizette Bonanno, who is going to be our community leader. You're also going to hear from Chris Woodcock, who's a first responder, and Dr. Benjamin Abbo, who is a medical professional with information on the virus. We also are able to provide you with virtual resources to get tested today if you're exhibiting symptoms. So we ask you to interact with us, get your questions answered, and we're here to help you. And again, I'm Karen Turk. I'm with the Esther 414 Foundation. We're a group of women volunteers, and we have our local community leader on site, Dr. Lizette Bonanno, and I'd like to turn it over to her.
Okay, good.
Hello, my name's Lizette Bonanno. I'm an ambassador for the Esther 414 Foundation. I'm on my I'm here today to share with you valuable information about our local community and how you can get the help you need. The purpose of this town hall meeting is to help us conserve valuable resources and to learn how to spread the truth and not the virus. You will learn more about testing and how you can get access to medical staff after my presentation. There are several food pantries available in the Tampa area and their surrounding communities. And the first one I will list is the Bay Chapel Food Pantry that's located on 20150 Bruceby Down Boulevard. That's considered New Tampa. They're open from 9:30 to 11:30 on Saturday. But just to tell you, although that they are listed just on Saturday, Christian Brothers Automotive, the owner, Marty, has stated that you can come at any time to his location, which is right next door to the Bay Chapel Food Pantry, and pick up any food that you will need. His number is 713-409-7923. And he's also, as I said, located right next to the Bay Chapel Food Pantry. We also have feedingtampabay.org. Their number is 813-865-4822. They have Trinity Cafe at 2 locations on Nebraska and Bush Boulevard. They're open from 11:30 to 12:30. They have breakfast meals. They have, all these are drive-through, so they will assess you when you come in. And if you're in need of anything other than the standard food package, for instance, Depends or diapers or milk for your baby, then you will have to state so when you're assessed. And they also have the Publix Community Market, and their number is 813-254-1190. The next food pantry in the Tampa area is the Feeding Tampa Bay, and you can find them at feedingtampabay.org. Their number is 813-865-4822. They have senior programs and housing facilities. Metropolitan Ministries is another one. Their number is 813-209-1000. They have food boxes available Monday, Wednesday, and Friday from 10 to 2. You will need a photo ID in order to receive a food box from Metropolitan Ministries. They are located at 2301 North Tampa Street, in Pasco County. They are located at 3214 US Highway 19 North. Now we'll turn over to Naples Food Pantries. Their number is 844-385-2404. And this is Catholic Charities. They have several locations, one in Bonita Springs, Juan Diego Outreach Center. They're open Tuesday from 9 to 1 p.m. Their address is 28360 Beaumont Road. There's one in Naples, Judy Sullivan Resource Center. The address is 3174 Tamiami Trail East, and they're open Tuesday from 9 to 11:30. The Fort Myers location in Lee City is at Elizabeth Guliana. It is open on Friday 9 to 1 p.m. Their address is 4235 Mission Avenue Link. And they also have a pantry at St. Margaret's Catholic Church in Clewiston. If you need prayer or want a guide on how to pray or would like the listing of community info shared, please visit us at www.esther414help.org. Thank you, spread the truth and not the virus for such a time like this. And now meet our good doctor, Benjamin Abel, an emergency physician. He is working in the trenches each day to help save lives. Welcome, Dr. Abel.
Thank you very much. Afternoon or morning, depending on where exactly you are. I am first going to point out that I am over 6 feet away so that you can hear. Far enough away from everybody. As an EMS physician, as an emergency physician, it's really important to realize that there's a lot of scared people out there, rightfully so, but we don't want to scare you into making the wrong decisions. If you do need to come to the hospital, or you do need to see your physician, or you do need to call 911, then you still need to do that if you're severely short of breath or anything like that. However, we want to be able to give you the opportunity to not necessarily get others sick. And with that, we can really protect ourselves and protect others. So the importance of being able to get in touch with a physician, whether it's your own physician they already have, or one of ours, as long as you can reach somebody, that's what's important. So we're going to go ahead also and make sure that we answer any questions that you might have, because there's a lot of misinformation out there, which is just as dangerous as not having information. The importance of what we're doing, from my opinion, is we're helping to keep you at home and connect you to medical professionals to teach you the right things to do to keep yourself safe and keep others safe. After all, the Greek root of doctor actually means teacher. So we need to teach you in terms of what's right and what's wrong, because there's a lot of misinformation there. I know that also we do have paramedic Woodcock here, who has a couple of concerns from the paramedic point of view. So I'm going to turn over to him, and then we'll come back and I'll answer some questions.
Hello, my name is Chris Woodcock. I'm a retired firefighter paramedic from Seminole County, Florida. I'll bring my mask down so you can hear me a little bit better. I'm a 30-year retired firefighter paramedic, so I've been in the streets for a very long time, dealt with a lot of things, but this is by far probably one of the most scariest events that we've had that's ever happened. The people that I used to work with, there's a lot of problems going on with that right now. So I want to address those kind of issues. First, I want to thank the Esther Foundation for their sponsorship. Also, Goodwill. Goodwill, one of the events that's going on right now. Within Seminole County, we've had an issue where there were quite a few paramedics that were brought to a scene, also EMTs, and were exposed to somebody who they did not know they were going to be exposed to, which you can probably guess is a big concern. You go to someone's house, they don't know if they have the virus. This was a person that for other reasons, COPD related problems. And by going to his house, and they transported him for his supposed COPD problem, he got to the ER. They did the testing on him, found he was COVID-19 positive. They sent the word out to the first responders, these paramedics, who at that point numbered, I believe, at 9 personnel. So what happened from then is those people were sent home, and they were then quarantined for 14 days. So not only did they have to keep themselves safe with masks, whatever other protective measures they had to use, but the possibility of exposing all their other family members, their children, their wives, their moms, dads, you know, and any neighbors possibly. So it is a big concern. And this is why we're trying to push this so much right now, is that we want people to know there is another avenue, and that is telemedicine, which is our big push right now. So I don't know, Dr. Abo, do you want to talk? We're gonna see if we're gonna get some more question answers here from this. Bear with us 1 second. Okay, I'm gonna have Dr. Abo come and sit in this spot right now for me, just because we're gonna get a better picture. And without further ado, I'll switch with Ben.
Okay, so as I was starting to say, there's a big fear of lack of information, but also there's a bigger fear for me in terms of misinformation. So I want to go ahead and first describe for you basically how the telemedicine would work, so that we can put you in touch with medical professionals, PAs or physicians, nurse practitioner, so we can get you the appropriate testing or point you in the right direction. And then I want to answer a few questions, because there's a lot of things that I see out in public, and people ask things and they share things online, and it's the power and the both for pro and con of social media. So basically, if you are severely short of breath, you are altered mental status, you're just really worried, if you can't even do your normal things like walk down the hall to go to the bathroom, that's probably a pretty good sign that you're having some breathing issues. Those are very appropriate times to go to the emergency department throughout this pandemic, as well as probably to call 911 so that people can take appropriate care for you. After all, EMS does deliver in a very important part of our healthcare system. But if it's not that bad and you don't have a physician that you can call or that you can get a hold of, then what you can do is you can sign in and make this telemed appointment, and the turnaround's actually pretty quick. They would take some basic information, and through a private setup, they'd put you in touch with the appropriate medical professional, whether it's me, a physician, a PA. These people will be able to see you, and you'll be able to see them straight from the comfort of your own isolated or quarantined or socially distant home. And we can take a look and we can talk about the risks and what's going on, and overall assess you. And if we feel that testing is required, then we could actually send an e-prescription and even send you a package so that we can get the appropriate testing done. It might be to set you up to go to a local place to get testing. We might be able to get you the testing at home and then have a fairly decent turnaround depending on the way the numbers are and where you're at. An important thing to realize out of this is it's not just a means to get tested. Just because you get a test and it's positive or negative, there's a lot that comes out of it that you really need to interpret. I can do a test today and the results come back tonight or tomorrow and it says negative, but that doesn't mean that tomorrow or 2 days from now, I'm not gonna get sick or that I'm gonna spread it to somebody else. So all these things that are honestly working in terms of social distancing and all, even though it's hard, are helping us actually get through this. Likewise, we'd be able to get you information in terms of where to go for other follow-up instructions. Maybe you actually end up being diagnosed with something else, so we can get you the appropriate medications. And again, the importance of everything is appropriate education, appropriate testing and diagnostics, and appropriate instructions and treatments. And that's the important part of it. I think it would be worthwhile to make sure that you know that you can type in any questions that you have, which we'll start answering some questions in a moment. But a couple things that I know are going to be asked, and in terms of kind of what I'm seeing also, you notice that all of us, we're staying at least 6 feet apart. We're not actively doing anything else like that. And when we're close or doing anything interacting, we are wearing masks, whether they're homemade masks, like my 2 other colleagues here are wearing, or I have even a buff or rag or whatever, that also works. These are very beneficial right now when you're out and about in public or anything else like that. You don't necessarily need the medical grade masks if you're not doing medical grade things. Just like if you're not welding, you're around toxic fumes, you don't need those things. And quite honestly, if you can't get a hold of those N95 that's always talked about, or N99, that's okay. Don't worry about it. These are going to take good care of you in the meantime. This is why even surgical masks, or these, as soon as EMS gets to you or you come into the emergency department or doctor's office, we're putting the masks on you. It does not need to be those N95 things. At the same time, I really don't want it to be a false sense of security. You need to make sure that you're putting them on and taking them off appropriately. So you notice that I'm not touching my face over and over. I'm not touching the front of the mask. Even when I'm putting it on and off, I'm doing it from the sides and bringing it and try not to touch my face. Pull from underneath so you can still hear me pretty well, but I'm not here, I'm not fidgeting with it, because if my hands are dirty or anything like that, I don't want to then touch my face and then bring it up, or rub my eye, blow my nose. Same thing, if you have to blow your nose or you sneeze, you do it into something, you do it into your elbow, you wash your hands no matter what. Be cognizant of a lot of what the stores are doing in terms of the 6 feet distancing, at least maintain safe distance. Chris and I were actually picking up food somewhere, and they had all the markings, which I appreciated, but they weren't even 6 feet apart. So really, I was trying to get more people to be at least 2 of those markings across. And then I've seen some pictures, and I know where some of these ATMs are, where there's multiple banks ATMs next to each other, and they had the lines and the X's where to stand 6 to 7 feet apart, but you're no further away from the person to your left or your right. This is not a weird game of checkers. The virus knows how to go forward, backwards, up, down, left, right. So with that, someone asked a terrific question here. Is 6 feet apart from the grocery line safe enough? Should I wipe down my groceries like a box of cereal? That is a really wonderful question. It's a minimum of 6 feet. I do my best to really skirt around people. I still smile and try to be friendly, hello. But really just as far as possible, because you don't know when they're going to sneeze or anything like that. And just to keep it. Otherwise, so far, it really seems that 6 feet should be a good amount for the normal flora and things that might spray from people talking and doing their normal things, breathing, panting very heavily. Now, when you look at how long the virus can actually live on different materials, plastics versus metals being longer than cloth and all, you have to take everything kind of with a grain of salt. Yes, before I get into the house, I actually wipe things down. Because I don't know what's been on it or when someone else touched it. So I do at least a quick wipe down with something before I put it in and bring it into the house. And for me, I have a garage, so I'm able to do that in my little containment area, so to speak, before I bring it in. And likewise, I don't use those bags. I ultimately use when I'm pumping gas or something like that, instead of bringing the bags inside, because they've been around and touching different things. I also have that I keep in my trunk, a pillowcase that I lay out. That's what my hospital shoes go on. But also that's what I put my grocery bags onto, because I don't want to get my rubber mats in my car. Because I have rubber floor mats as opposed to cloth ones. Again, rubber, metal, plastic, that will hold the virus live longer than cloth will. So that's another reason why having the cloth handkerchiefs are actually pretty decent. But that's a great couple of questions. Someone else asked here, washing a homemade mask or rag, what's the rule? in terms of washing or how to, I would do with normal soap and water, laundry detergent. You probably might not want to bleach everything. If anything, all you would even need at the most would be a little bit of bleach, a little capful in a whole big tub. But I would wash it every other day at least, or anytime it gets wet. I definitely would do it. And probably if you're the type that's coughing or sneezing into the mask, or you're the type that keeps touching your mask and adjusting your mask, you probably should be washing it or switching it around every day. And it's not really clean until it's completely dry. Okay. What is the concentration of bleach to water if you want to mix a disinfecting spray? You can basically take a half a capful of bleach into a big bucket, and that's plenty strong. And you could even probably dilute it down a little bit more than that. Another question is, do homemade masks protect you? As I already said, yes, they do. You can see I'm wearing just regular cloth material for when I'm doing my out and about out in public. I do feel like I'm going to, I'm a bandito or something like that, and stuff, but at least, I'm also able to match my embroidery and my sneakers. But yeah, the homemade stuff does help. And those are the kind of things when out in public you really should be doing. When you have somebody that stops by, at the front door, you absolutely should be wearing them. All of my local fire departments and EMS stations are also wearing masks just around the station because we're forced to interact with each other. And then when we go on calls, we do the higher grade ones because we're putting ourselves, like Chris, more at risk. Those are terrific questions. Will vinegar work to kill coronavirus? That's a very good question. I'm going to look more into that. It would really depend on the percentage of like kind of the alcohol in it, and whatnot. Everything else is so readily available. I really wouldn't worry about homemaking or homeopathizing something like vinegar. But it's a good question. I'm going to look into it to see what kind of percentage you would need. But soaps, regular soap, a bar of soap works great. So that's why laundry detergent also works. When I wash my hands, I prefer to use a bar of soap because I'm making sure that I'm actually scrubbing, and it's that mixture of the chemical structure, so to speak, of the soap, and as well as the manual scrubbing, all parts in between your fingers. Don't forget those thumbs. Don't forget the back of your hands. And I go up a little bit past my wrists at least for general things. And when I'm at work, I go up to my elbows just to make sure there's no spread there. And that works well. And if you're using any of the alcohol-based ones, whether it's Purell or any brand or anything like that, make sure you're still rubbing and cleaning. You don't have to douse too much, but you really need to still rub and touch all those places. Just because it gets on the front part of your fingers doesn't mean it's cleaning the back. Is it safe to go back to work in an office? And is it safe to get vaccine or antibodies? So first, let me address with back to work in an office. Really, it depends. I truly believe, in my experience as a paramedic, public health professional, physician, that we really need to, only really essential things, go out, do things. If you have the opportunity for now to work from home, the better. If you have to have meetings, have them where you can socially distance and everything like that. You have to be very cognizant in terms of what you might be touching and sharing and moving around. So it really depends if it's a safe environment for you to work in terms of the office. But if it's possible, I would absolutely stay back. And not to mention, if you're showing any symptoms, definitely you shouldn't be congregating around other people or going to work. In terms of the vaccine and antibodies, vaccines, there are no vaccines for coronavirus. If you have not received the flu vaccine, you absolutely should. If you haven't received other vaccines that are not up to date, you absolutely should be up to date on those. Is it going to give you protection specifically to COVID-19 or this coronavirus? No, but I sure as heck don't want to be down in the dumps, very sick from influenza, and then on top of that, be exposed to coronavirus and my immune system is already down. And that kind of is a segue into another really important point, and that is that just because the elderly, the immunocompromised, or those with medical conditions are at higher risk of death and higher risk of bad issues, that doesn't mean that a young, healthy person is not at risk. Again, they are just more at risk. I have colleagues that have intubated left and right people. They've seen people die that are young in their 20s and 30s. And in Florida, it's starting to creep up where the young and healthy, there's a lot of people that we're picking up that actually have COVID-19. And so don't fall into the false assumption that, oh, I'm young, I'm healthy, because denial is not just a river in Egypt. How do we know if we have the common cold, allergies, or the virus? That for the most part, there's no specific thing that anyone else would know, but that's a whole part of the telemedicine that we have set up, so that it's a combination of physical exam, potential testing, and then also the interview from a medical professional to really help us determine if you have a common cold, allergies, or the virus, the COVID-19 virus. Karen asked, I've heard that dogs can catch it, but can't give it to us. And is the virus mutating or getting stronger? Definitely, there are mutations, and there's concerns that in certain places we're seeing stronger strains in different areas. At the same time, the same strand might be much more detrimental to me than it would to Chris, or anybody else. So it's kind of a tough combination in terms of that. Right now, we aren't seeing much. There's a report of like 1 or 2 dogs in a certain country, I think in China, and 1 in Korea, and a cat. And we have the tiger in the Bronx Zoo. We don't know enough yet in terms of how much they're able to get it to us, or if we're able to give certain things to them. They're definitely being exposed. And that's how all of this kind of starts, the zoonosis and the transfer of viruses and all, but we don't really know. I do know that for me, who's an avid dog lover, and I have my Otis, my man, who's my miniature dachshund and my assistant medical director, MD 1.5. Before I pet him, I'm doing things, my whole life's been turned upside down. When I come home from work, I am completely disrobing and washing my hands. Even when I just go outside and I do things, I'm washing my hands before I pet him, before I hug him and things like that. And then I'm bathing him every so often just to make sure. Otherwise, he's not really leaving the house, but I'm avoiding the potential of giving something to my dog or my dog giving something to me, just like as part of the good practice of I don't want to get sick or get anybody else sick, whether they're human or canine, walk on 2 legs or 4 legs. I just really need to do my best to just spread truth, spread knowledge, and not spread the virus.
I got a question, Ben.
Yes.
A woman or someone had asked a question about, or you said it about plastic or vinyl, whatever is inside your car. What about the temperatures that the daytime temperatures reach inside a vehicle? Is that going to be enough to destroy the virus? We have to worry about that kind of thing. My car temperature is 110 degrees, 115 degrees or more. Good question. The car temperatures, while we need to be very cognizant and not leave pets or kids in cars because it gets very hot, the temperature is not going to get hot enough to really do anything to fight the virus. It's not going to be like oh, good, I've got black leather interior and I live in Florida, so that can decontaminate my car. I definitely would not rely on that. I would treat everything the other way around. We call things in certain viruses colds and all. The notion of, oh, colder temperatures is going to make this work. We're in Florida, right? And we have a lot of cases and people are dying from it. The same in this hot, humid environment as up north, where it's a lot colder. There are people dying there too. So the notion of our ambient temperatures, I would not rely on. What about UV light? I know bacteria are affected by UV light. What about this virus or any viruses? UV light, there's
The other question is, what about UV light to be able to do it? There are 3 types of UV radiation that comes from the sun: UVA, B, and C. And UVA is actually used medicinally for things like eczema and certain skin things, to a certain extent. But those UVs are also what can cause skin cancer. At work, we do use UV lighting to disinfect certain things, but direct on human skin would be actually very dangerous.
So if
And
someone's outside in the sun, I guess is what I'm saying. You go to the beach or to walk around.
if they're outside in the sun, you're probably not getting enough UVC to be able to protect you from the virus. So again, living in Florida is great, but it's not going to help you because we're closer to the equator. But that is a good question.
Any more? No more questions?
You want to double check the screen there, mine. I saw a question pop up there.
Hydrochloroquine, thoughts on this? We're hearing so much about it. It's been around since World War II and it's on the WHO essential medicines list. What is the deal?
Hydroxychloroquine, quinine, all those things are, so these are medications. Those happen to be antiparasitics and malarial drugs. Yeah. Malaria based, which malaria is a parasite. It's not a virus. Azithromycin is an antibiotic. It's not an antiviral. These things, and a lot of the talk about it, while there are trials that have started to go underway right now, I don't see any benefit out of doing it. I am only using it. My ICUs are only using those things right now in conjunction when the person is really, really sick and we're kind of throwing things at them, trying to do different things. The medicines have been around for a long time, but so has arsenic and cyanide. So it doesn't, because things have been around for so long, doesn't mean that I necessarily need to use them. Just as many cases I've been hearing in terms of people saying, oh, it worked, I've been hearing some very negative things too. So I'm not convinced at all that it's safe enough to do. That's part of why I'm literally financially so in debt, and I went to medical school to practice and residency. I'm trying to learn the best things and weigh the risk benefit for things. But the people that it has worked for, reportedly, I don't know if they just happen to get better anyway, or it's because the wind was 25 degrees to the east, or if it was because that medicine combination. That's why it's really important to realize the sources of what you're reading and where they're getting it from, and proper research. There are trials, we're trialing it, but we don't know what's there yet. And it's also important to realize that the plural of anecdotal stories is not data. The plural of anecdotes is anecdotes. So there's a lot of talk about it, hustle bustle. There are politicians that are talking about it, and chiropractors, and just a lot of people. But we don't know.
We're dealing with science-based medicine.
Yeah, it's really important to have a combination of evidence-based medicine and experience-based medicine and bring it together. So we actually have science-based medicine, not try different things, because there are risks. If you contract the virus, how long before you start showing symptoms? It depends on different people, because about 50% are never showing any signs, except for maybe a little sniffle. But in general, usually it's a few days from what most of the reports have been. And we're talking about hundreds of thousands so far. And some people, it's a delay up to about 10 to 14 days. And this is why we started invoking the 14-day quarantine, or 14 days of strong isolation if you're high suspect for it, because we want to see if you started showing signs or symptoms within that time. But everyone's a little bit different. And at the same time, there's a lot of overlap to other things, like similar, like influenza or other viruses or other colds. Heck, you could become short of breath because you're having allergies. I'm sneezing around this time because there's pollen all over the place. And I feel like I'm going to get shot because I'm sneezing in public, but I swear it's my allergies right now. So everything with a grain of salt.
I have one last question, Ben.
Yeah.
Acyclovir, those beer medications, antiviral medications? I don't know anything about them being used in the kids. I'm sure they're not being because of quote unquote.
We're not using them because it's not, they won't work for these types of viruses. It's a good question. There's all different species of viruses, just like there's different species of dogs and cats, and we have to do different things differently. All right. I think I answered all the questions that I see on there. So with that, I want to leave you and kind of go back to if the others have any questions, but it's important in terms of the stay at home and socially distance as much as you can. And unless you're severely ill right now, you really should try not to go to the hospital, if at all possible. And we're trying to make sure that we're giving you an avenue to be able to get a hold of a medical professional, because I get it. It's very easy for me as an emergency physician to say, call your doctor. But there are people that have physicians that they can't get a hold of. And then there's also people that just don't have physicians. So we're trying to make sure that we're putting and closing those loops. So please take a look at things, consider things, and take the social distancing and hygiene and masks and all very seriously. Back to you.
Thank you very much, Doctor. That was really informative. I know there were a lot of questions on that list that I got answered, and I know there were a lot of other questions too that I thought I should have asked. So thank you very much. It was great, very informative. I want to turn it over now to Christopher Woodcock, who's going to talk to us a little bit about the first responders taking part in this crisis.
I'm going to move out of the way so that Chris can come here in the center for that.
Welcome, Chris. And thank you on the front lines. It's so important right now.
Hi, Karen. Regarding what I had said before. Yeah, so the story I had mentioned before was, and this was a few weeks ago, so the outbreak, if you will, had just started, and there wasn't a lot of, there was concern, but a lot of these guys were, not probably taking the precautions they needed to at those times, especially when you're dealing with people that you run in all the time. We get a little bit complacent. You got a guy that's got one kind of disease process. We see him all the time, and you just kind of, take it for granted. And so those guys did that day. We had 9 people total that were exposed to this person without any kind of protection. And so because of that exposure, those people were put on quarantine. They were not allowed to go back to work. They were quarantined for 14 days. But again, they're having to go back home. They're not 100% sure if they have the virus. They got to worry about their families, children, their wives, husbands, their parents, possibly neighbors, sisters, brothers, whoever it may be. So, you're talking about a possible exponential exposure of people, just from these 9 individuals. And this is happening everywhere around the state. We know stories, Ben's told stories about, his own people that have had exposure problems, from Miami to Gainesville, and I'm sure all over the country, these kind of things are going on. So that's the big issue. And we want to make sure that people know this telemed practice is something that, is out there for these people. They can get these telemed appointments, they can be evaluated, find out if they need to go and get a real test. And that's what we're really shooting for right here. That's the big push.
We'll go back to Karen for closing statements. Thank you, Julie.
Thank you, everyone. That was amazing. I'm again so thankful to be a part of this, and I want to thank the Esther 414 Foundation for bringing me on, as well as the other community volunteers through the foundation that are being a part of this. A huge thank you to the Marriott for hosting this today. Remember, to everybody watching, go to flu.com. Telemed is providing testing. It's very important that you can do this from the safety of your home. You don't have to leave home to get tested. So if you're experiencing symptoms, go to flu.com and get the information that you need. Thank you very much for having us. I will see you at the next town hall. You can find a town hall in your area if you're somewhere other than Tampa. We're going to be hosting these all over the country. www.coronavirustownhallmeeting.com, and I'll see you soon.